Pediarix Syringe is a combination of vaccines given to children between the ages of 6 weeks and 7 years old. It helps prevent serious diseases like diphtheria, tetanus, pertussis, hepatitis B, and polio. Vaccination is crucial for providing immunity against these life-threatening diseases, as the vaccines help the body to make its own protection, antibodies. It is important to follow the recommended dosage and timing for the best results. Before receiving the Pediarix Syringe vaccine, make sure to read all the information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. This vaccine is administered by injection into a muscle by a healthcare professional. For infants, it is typically given in the thigh, while for older children, it is given in the upper arm. The Pediarix Syringe vaccine is usually given in a series of 3 doses at 2, 4, and 6 months of age, or as directed by your healthcare professional. It's important to closely follow the vaccination schedule provided by your healthcare professional. Some common side effects of the Pediarix Syringe include pain, swelling, redness at the injection site, as well as mild fever, sleepiness, fussiness, and loss of appetite. If these effects persist or worsen, it's important to notify your healthcare professional. They can advise you on using acetaminophen to treat any pain or fever caused by the vaccine. In rare cases, people may experience symptoms like fainting, dizziness, vision changes, or ringing in the ears after receiving the injection. If your child experiences any of these symptoms, it's important to seek medical attention immediately. Sitting or lying down can help alleviate these symptoms. It's important to remember that this medication has been prescribed because the benefits outweigh the risks of potential side effects. While serious side effects are rare, it's important to contact your healthcare professional if your child experiences high fever, prolonged crying, unresponsiveness, unusual pain, muscle weakness, or seizures. In the event of a serious allergic reaction, seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to consult your healthcare professional if you notice any other effects. If you're in the US, you can report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967. In Canada, contact the Vaccine Safety Section at the Public Health Agency of Canada at 1-866-844-0018 for further assistance. Before your child receives this vaccine, it's important to inform the healthcare professional about any allergies your child may have to vaccines or any other allergies. This vaccine may contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to discuss this with your healthcare professional. Additionally, it's crucial to provide your child's medical history to the healthcare professional, especially if your child has had a previous reaction to any vaccines, current fever or illness, immune system disorders, brain/nervous system disorders, or a history of Guillain-Barré syndrome. It's also important to note that this vaccine is not typically used for adults and is unlikely to be used during pregnancy or breastfeeding. If you have any questions about this vaccine, be sure to consult your healthcare professional. Now let's talk about the uses of Pediarix Syringe and how it can benefit your child. It is used to help prevent diphtheria, tetanus, pertussis, hepatitis B, and polio in children. The vaccine is typically given in a series of doses as recommended by the doctor. It is important to keep a list of all the products your child uses and share it with the healthcare professional to avoid any potential drug interactions. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. Always consult with the doctor before starting, stopping, or changing the dosage of any medicines. As for the optimal timing, the healthcare professional will advise on the best time to administer the vaccine to your child. Pediarix Syringe is used to help prevent diphtheria, tetanus, pertussis, polio, and hepatitis B in children. It is usually given to babies and young children in a series of doses. The first dose is typically given when the baby is 2 months old, followed by additional doses at 4 months, 6 months, and 15 to 18 months of age. It is important to follow the dosing schedule provided by your healthcare provider for the vaccine to be effective. The vaccine is given as an injection into the muscle by a healthcare professional. It is important to talk to your healthcare provider about any concerns or questions you may have about the Pediarix vaccine. If your child has already had any of the diseases that Pediarix prevents, they may still need to receive the vaccine to ensure continued protection. Your healthcare professional will determine if your child should receive this vaccine. Make sure your child receives each vaccination as scheduled and ask the healthcare professional when the next dose should be given. It might be helpful to mark your calendar to remember. If a dose is missed, contact the healthcare professional immediately to reschedule. Be sure to store Pediarix syringe in the refrigerator, but do not freeze it. Keep all medications out of reach of children and pets. When it is expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.